Hello, I'm Raul Santos from the University of São Paulo, and I'm talking directly from Barcelona at the European Society of Cardiology meeting. Today we had the presentation of 2 or 3 important trials on PCSK9 antibodies in patients with dyslipidemia. 2 of these trials were focused basically on patients with FH, heterozygous FH, and another trial was a more general dyslipidemic population that also included FH. The FH population, it's a population that unfortunately is underdiagnosed and undertreated. It's a disease that is more frequent than we thought. Probably heterozygous FH occurs in 1 in every 250-300 people. And of course in the families it's 1 in 2. And according to the European Atherosclerosis Society consensus document, probably less than 1% of FH patients are diagnosed and treated. So this is a real serious public health problem. Of course, when FH is diagnosed, we usually treat those patients with very high doses of statins. In many situations also, we need to add 2 or 3 other lipid-lowering therapy. Usually we say that an ideal LDL cholesterol level for FH would be something like less than 100 milligrams per deciliter or 2.5 millimoles per liter. And also when we go for those patients who already had a cardiovascular event, we aim even to lower levels like 1.7 millimoles per deciliter or 70 milligrams per deciliter. And we know that the great majority of FH patients, we are not able to achieve those values. More than 80% of heterozygous FH patients that take statins, take ezetimibe or other lipid-lowering medications in association persist with LDL levels above 2.5 millimoles per liter or 100 milligrams per deciliter. Therefore, it's a challenge to control LDL cholesterol levels in this very high-risk population. Antibodies against PCSK9 have been developed very quickly on the last 2 to 3 years, and there has been a huge amount of new data that came and was disclosed in recent meetings and important publications in journals like The Lancet and New England Journal of Medicine, showing that these drugs are very effective in reducing LDL cholesterol. Here at the ESC meeting, we had a presentation of one of these medications, alirocumab, that was tested in 2 studies that included patients with heterozygous FH, and the results were very impressive. There was an average of 50% reduction on LDL cholesterol levels on top of maximally tolerated lipid-lowering therapy. And in this study, around 60 to 70% of the FH patients were able to achieve an LDL cholesterol level less than 100. So this is very important. This is a landmark, in my opinion. These patients took the drug for almost 1 year, and the drug was very well tolerated with very low profile of side effects. These results are in the line as the results that were achieved with another medication of the class, alirocumab, that a few months ago the same results were present in different studies, and showing that this class of medication so far apparently seems to be very useful and very safe for the FH population.